Left or right markers must always be used in all films. Bakit? Para malaman ng radiologist kung anong parte ng katawan ang nakaharap sa kanila, be it ventral, dorsal, left, or right. Markers should be placed on the cassette where they will be clearly seen on the radiograph but not obscuring the required anatomy. Bakit? Because this can interfere the validity of the x-rays, possibly with the medical assessment of the image.
Markers should not be placed over the patient's identification blocker. The lead marker in radiographic cassette is also known as the patient's identification blocker, kung saan dito nilalagay ang patient's information as per example, the patient's name, date of birth, type of examination, and the date of examination, so on and so forth. Markers should be placed within the collimated film. So kung ano lang na part ang dapat i-expose. Halimbawa, sa collimated side, kung anong part ng ini-x-ray dapat yung marker ay nasa loob lang. Kasi kapag nasa labas ang marker, after nang ini-expose mo na process ay hindi na ito makikita. Dapat nakalagay lang within the collimation film ang marker.
Markers should be placed away from the location of the lead shielding on the patient, which means that if markers are placed under the lead shielding, then it will be unseen. Markers should be placed appropriately to identify the patient's left or right side, for patient's right side and L for patient's left side. Always remember that markers are used to correct anatomical side and prevent confusion, and not the other way around. When the extremities, the heart, the shoulder girdle are being radiographed, markers should be placed on the lateral side of the body. These markers shows up on imaging tests, so exact area can be located for further treatment or follow-up.
For example, we're going to use APL projection of the forearm. So APL has two exposure, the AP projection and the lateral projection. So in the forearm, since maliit lang naman siya, so only one projection must be marked. For indications, in AP exposure, we will put L if it's on the left hand of the patient. In lateral projection naman, we will put R if nasa right naman. Bilateral projection means both left and right hand. So if they are positioned in one film, both left and right markers should be used to identify the. So for bilateral projection of hand, so dapat dalawang kamay, which is the right and the left, should have markers.
For the lateral decubitus projection, the marker is indicating the side up or kung ano yung nasa taas. Now, this is an example of a left lateral decubitus wherein the X-ray beam is passing horizontally to the patient. The left side of the patient is nearest to the film and the right side of the patient ay kung ano yung nasa taas. So, ang marker natin ay R or indicating that the right side of the patient is yung nasa taas at mas malapit sa central ray. For lateral projection, side down or the side of the patient that is closest to the film. Now, this is an example of a left lateral wherein the left side of the patient is closest to the film. So, ang ating marker ay L or the left side of the patient.
When the spine is being radiographed in the lateral position, markers should be placed on the cassette anterior to the spine to be clearly visualized. So this is the cervical spine, this is the anterior part of the patient, and this is the posterior. So we are going to put the marker right here in the radiograph. So in this radiograph, the patient is in right lateral position, meaning the right side of the patient is near the cassette. When the chest, abdomen, or spine is being radiographed in an oblique position, the side nearest the film is generally marked. So in this radiograph, the patient is in right anterior oblique position, therefore the marker should also be in the right side of the cassette. So when both sides are on the film, either marker can be used. We can put the marker either only on the left or right side only, but we can also put the marker on both sides.